Well, first of all, I'm a Florida guy from Miami. Wandered up here in 1958 and went to engineering school here. Graduated in electrical engineering a long time ago. And so the good thing about going to school here is I knew about Shands. That was important in my life later on. And I did go to work with the Atomic Energy Commission. I shifted from electrical into the nuclear side of the business and I've been at it ever since. I do have my own business. It's engineering services to some utilities, but primarily to the government. And fortunately, I've got a lot of good people because I'm pretty well stuck here in Gainesville. Not that it's stuck, because I love it here in Gainesville. I'm a big sports fan, so that helps. My disease is pulmonary fibrosis. And everybody heard of pulmonary fibrosis? No? It's kind of a strange phenomena, and one that Dr. Boz and some of us patients have tried to make sure that the word gets out through advertising, marketing, things like that, because it's not uncommon. And to give you an idea about where it ranks, there's about 50,000 new cases of pulmonary fibrosis, and that's only one of the diseases that the transplant team needs to deal with. There's an example of this, almost exactly the same number of deaths from breast cancer there is each year from pulmonary fibrosis, which is 40,000. So it is a disease that it's surprising that you haven't heard of it. And the bad thing about it is it is a terminal disease. There's no cure for it. So that if anyone wants to live, they need to be paying attention, and they need to get from wherever they are to a transplant center. That is, if they want to continue living. Come see Dr. Boz, that's their only chance. I can tell you that there's an award offered at least the last 2 years, the excellence in lung transplant centers in the country. And the transplant team here at Shands has won that award the last 2 years. This past year it was 2 out of, I think it was 135 transplant centers. 2 of them won this award. And this is one of the places. I guess when I first came to see Dr. Boz, I feel like I was blessed in that the doctors in Sarasota, where I was living, it's not that they were clueless, it's just that they were clueless on the timing and how to deal with my disease. So once I got here, I went on oxygen pretty quickly, and it was like I was going downhill. First notice, walking up those stairs, so I'm just getting older. Well, it was a little more than just getting older. So once I got here, ended up on oxygen and went through the process of getting on the waiting list for transplant. And that's no piece of cake, I'll tell you. They want to make sure there's nothing else wrong with you except the lung disease. Your heart, the rest of your body has to be strong enough and healthy enough. And so it's quite an extensive process to go through. In November of 2002, and I'm in a wheelchair. I'm this little gray man. And says, we've got to do something here. And he did. And on the 3rd of December, I received a transplant. And I can remember some of the amazing things you go through with it. Dr. Staples over there, he's an artist. The job he did on the surgery is truly amazing. And I ended up in the hospital room, and the fact that I didn't have oxygen, it was like a miracle. Here I am, I'm struggling with every breath, sitting in this wheelchair, and then all of a sudden I don't have oxygen. I'm feeling a lot better. Of course, the oxycodone helped. Things like In the process, I had plenty of time to write a letter of thanks to the donor family, and I didn't know whether that would ever get to them or not. That's kind of a tricky area there, that relationship between the donor family and the donor and the patient. I don't quite understand it, but within a few weeks, I get this call and I find out who my donor is. And it was a 34-year-old, beautiful woman, tragic story, but the family was so great. It was like the only silver lining in the whole death of their daughter was the fact that there are a number of people that are alive now because of her commitment. And she told her family that she was a donor, and they went through with it, and I was the lucky guy that got her left lung. I see them once in a while. Her niece plays softball over here at Santa Fe. I've gotten a chance to go over and watch her play softball. And so that life has really been good for me for almost 10 years now. Because you're going to run into people with pulmonary fibrosis or people that need transplant. And a lot of them would like to talk to somebody who's been through it.